this is an artist's rendition of the Zika virus. It's beautiful, it's nice, it's going to be in your bloodstream like any other virus, right? Except this one has the press, okay? And so one of the things that I always like to look up is, where did this come from? How did it get here? You know, it sounds like it shouldn't be in our hemisphere, and it never was. It really started in Africa. It was really seen in 1947 by this laboratory. It's very well funded, as you can see. And basically, they studied primates, and they isolated it from the primates, and really the primates weren't that affected. It was just there. They called it the Zika virus, and then at some point, it jumped over to the humans. And so their theory was, and this is over thousands of years, by the way. It's just that in 1947 they discovered it. But the theory is as human beings were putting, in Africa, putting everything together and gathering their water, they had water sitting inside of their huts. And so these mosquitoes would breed in the water, and eventually somehow the virus jumped onto the human being at that point. So to understand what this is, it's really an arbovirus, okay? It's an RNA virus transmitted by arthropod, in particular the Aegyptius mosquito. And again, this was spilled over from animals, okay? So there's other examples. There's dengue, and I'm sure many of us have seen dengue, right? I've seen a couple of cases of that. I know Doug Hargrove told me about an exceptional case that he transferred over to Jefferson with atypical findings, and turned out to be Guillain-Barré in that particular patient. That was very interesting. West Nile, we all know that was in the late 90s. That was big news, hot topic. The very old and the very young were really affected. And what did New York City do? They pretty much sprayed the entire city, and so our asthma rates went up. And, the death rates were low, but they were sensationalized. But, what are you going to do? That's what they did back then. And, of course, you have yellow fever, which there's a vaccine for now. More recently, chikungunya was there, and I don't know how many people have seen those cases. Generally, they show up from an endemic country, and they talk about having joint aches, and basically you just treat them with NSAIDs. Really, nobody died from that particular virus, but that was sort of hot and heavy last year. This is what the mosquito looks like. It's a nasty-looking bugger. If I saw that on my arm, I would definitely slap it and destroy it, immediately. But these mosquitoes are made so that they don't really cause any feeling on your arm, and it's very interesting. And then when their proboscis goes in, they suck your blood out, and within seconds they fly off, and at that point is when you feel it, and by then it's too late, right? So that's generally what the female mosquito does. The male mosquitoes don't do this. It's really the female mosquitoes, because they need the blood to breed, right? So they have to continue on with their life cycle. All right, so this particular mosquito is also implicated with dengue, chikungunya, and yellow fever. And as a matter of fact, the CDC reported that this mosquito is actually endemic all the way up to New Jersey and 30 states in our country, which was very interesting. So that means that the vector is there, especially for the summer, once it starts to get hot and humid, that somehow Zika will show up at our borders. So how did it get here? So you can see on this map that it really started in Africa, and this is true of all the other viruses that I just talked about. And basically it starts in Africa, and it migrates east until finally it shows up into our hemisphere. Okay, so we have airplanes that really help us connect each other really quickly, and maybe you have some mosquitoes that get on the airplane as well. But it's really the trade winds that carry the mosquito over all the way over to our hemisphere. Now, if you look at the people who are infected, 80% of them are really asymptomatic. Now, you think about that, So that means that these people have some sort of immunity to this virus, and they're able to fight it off. But if they do become symptomatic, then the disease lasts for 2 to 7 days. And that's pretty much what they complain about. They get a fever, sometimes they can get a maculopapular rash, arthralgia, a non-purulent conjunctivitis, and a headache. I had that last week from a virus, a nasty one, that just laid me out for like 3 days. And it wasn't a flu. I did test myself for that. I did get my flu shot. But, it's a typical virus with these symptoms. Now, occasionally you get thrombocytopenia and subcutaneous bleeding, but that's really rare, okay? And this can last for several days to 1 week. And again, fatalities are very, very rare. So we're not really talking about fatalities. What we're talking about are the complications that are associated with this particular virus, right? So this is what Brazil is doing. Now I'm Spanish, so sometimes I watch Spanish TV, and if you look at their newscast, it is very, very dramatic. They have these guys going in, they're spraying the street, people holding their babies out there. Now, no. You see how they're covered from head to toe with a mask? Obviously it's a poison, and more than likely they're using resmethrin, which was the actual insecticide that was used back in the late 90s up in the Bronx. And again, like I said before, that really caused the asthma rates to go up and in that particular area. So, and they're going into houses with this. Like, people are actually asking them to come into their house and spray the house. Yeah, so not a good thing, And if you look at really the poorer areas of the big cities in Brazil, in particular Sao Paulo, they're very congested. It's sort of like Patterson, very congested areas, a lot of people living in a small area. And what's worse, they have their water sitting there. So they have water, they don't have plumbing. They have water. When it rains, they collect it in a barrel. It sits in the barrel, and guess what's in the barrel? Mosquitoes, right? They're breeding, right? So not a good thing. So they've been trying to treat the water as well, because you just can't tell these people to empty out the water, because that's what they use to bathe, that's what they use to drink, to cook, etc. The biggest complication that we've seen to date is microcephaly, right? So this is the abnormal formation or the lack of formation of the head, and with that comes other neurological issues for that particular patient that is born. Now, Gilmore, who's a professor, I think up in Connecticut, University of Connecticut, he wrote out this paper in an attempt to think about why this is happening. And his theory is it basically disrupts the neuropeptides. And so this virus actually crosses into the placenta, affects the neuropeptides in some way, the growth factors, that are needed to develop the normal brain. But more recently, not only does it affect the brain, but it affects other areas of the neural system in the particular fetus. So, and I'll get into that in a minute. So this is a theory. What is known is that the fetuses that are born do harbor the Zika virus. They have tested those fetuses with microcephaly, and they do harbor the Zika virus at birth. So that means that the Zika virus has transferred over through the placenta, theoretically, right? And has affected their growth along the way. The younger you are, so in other words, if the mother gets exposed to the Zika virus much earlier in pregnancy, the greater the likelihood that they'll end up with some sort of neurological deficit, including microcephaly. So in the Brazilian experience, there's a 20-fold increase in that from 2014 to 2015. And there's no other links associated to date. Now, as of yesterday, and I'm not sure, some of you, I'm just going to put this up for a second because I didn't get a chance to update my slide. I did update it last night, but the New England Journal of Medicine posted up a paper that the Zika virus with birth defects, there's now a cause. So they were thinking it might have been something environmental, it might have been a lack of a vitamin or something, but now they pretty much realize that it is Zika. So this was put out yesterday, and what these researchers did is they used a Thomas Shepard criteria. And the Thomas Shepard criteria, I wasn't familiar with this until I read it, just to put it into perspective, is a 7-point system where they just go into it and they answer a series of questions for these particular patients. And they take environmental factors, medication factors, etc. And if they get a certain score, then it's due to that particular insult, in this case, the Zika virus. So this was just published yesterday in the New England Journal of Medicine. If you guys want to read more into it, it is called the Zika virus and birth defects, reviewing the evidence for causality. All right, so at this point, with my topic, they actually stated that they believe that the Zika virus was the cause. Now they're saying it's 100% that it is. Okay, so what are we doing about it? The CDC, ACOG, and SMFM have recommendations that they put out, and they put out a consensus statement last month, and they basically stated that patients who are pregnant, who are coming from an endemic area, who test positive for Zika, will need a detailed neurosonographic examination and a follow-up ultrasound at 3 to 4 week intervals during their pregnancy. Okay, so this is their recommendation from those 3 different colleges, and it's something that our OB doctors are doing. However, we're still waiting on the test for the 2 patients that we tested because it takes a while to get that test, the Zika test. So Guillain-Barré is another one. Now, Guillain-Barré, classically, if you remember your boards, it's always patient has diarrhea, the patient was diagnosed with Campylobacter jejuni, and about a week and a half later, they start to have an ascending type of paralysis, right? So that's classically Guillain-Barré, and the whole issue is the myelin sheaths get affected. So the transmission is not there. It's an autoimmune type of disease from the insult of that bacteria with the antigen buildup, etc. That's a theory. And so you get that, right? So with this particular virus, in this particular paper, French Polynesia, during that time, they reported these cases. All right. In the United States, there's 1 to 2 cases per 100,000. It's a very rare disease. Has anyone treated somebody with Guillain-Barré? I've seen maybe 1 or 2 cases. So there's a lot of people here that have seen a case. And generally, they're pretty dramatic, but it's all in the history. And as you start to take the history and you start to examine them, you admit these people and you watch their airway, because that's a big thing that they're going to lose along the way, potentially, if treatment is not started. So there's an increase of Guillain-Barré also in Brazil. And so this particular paper was done in French Polynesia, where the Zika virus had been there during that time period of 2013 to 2014. And they noticed 42 patients. And these 42 patients were all diagnosed with the Zika virus, on average 6 days post-exposure, and all of them were treated with immunoglobulin, intravenous immunoglobulins. And the patients were also, one patient was also treated with plasmapheresis. There was no deaths. So the good news is it's treatable. The bad news is if we get a lot of these patients, these are ICU patients, and I don't think we're ready for it. But hopefully, we'll see what happens in the summer. But there's something you have to think about in these patients who get exposed with Zika virus. Something new, and this is going to be, sorry for the small lettering there. This is going to be presented in the American Academy of Neurology this weekend, as a matter of fact, April 15 to 21. Any neurologists going to this? It's in Vancouver, Canada. It's a little cold up there. But they're going to be presenting this. So acute disseminated encephalitis that might be tied to Zika virus. Physicians or neurologists are presenting this from Brazil. They have a few cases like this. And what this is basically patients who have MS-like symptoms, multiple sclerosis-like symptoms. Now, with MS, with the talk that we had this morning, it's more of a stuttering type. So you get it, you treat it, and then it flares up again, and et cetera. So it doesn't happen with this. This is a one-time deal, and they're going to be presenting this, and it should be in the press next week once they present it. But basically, they're starting to notice patients in Brazil with this particular disease. So more to come this week. We just finished a sexual transmission topic. Well, guess what? Zika is sexually transmitted, right? So I don't know how they found out about this, but I guess it was all in the history, and they had an example of a patient who returned from a male who returned from a Zika-infested area, got the wife pregnant, and then all of a sudden she developed Zika-like manifestations, and then they tested her, and then she's pregnant, and now they're going to be following the pregnancy. But males can transmit the Zika virus via sperm. So somehow it is viable in sperm, and it gets transmitted. But there's no known transmissions from women to men. Okay, none to date that's there. But the examples are the males can transmit the Zika virus in sperm. And so the CDC is recommending that males traveling from an endemic area who have had, possible exposure or obvious exposure, that they should take precautions for the said time there. So if you're symptomatic, it's for 6 months. If you're asymptomatic, you take precautions for 8 weeks. All right, and that's probably going to change at some point, but that's what they're recommending right now because it is sexually transmitted. There have been reports that it has been in the blood supply in Brazil as well, which is very bad because there's no way to test Zika in the blood. Okay, so this is not a good thing. And it brought back memories. I don't know if you guys, most of you, there's a lot of people here with gray hair like myself. And if you remember back in the 80s when the HIV epidemic had many different colorful names back then, but it actually showed up in the blood supply as well. It just started to make me think as to how things progress during that time. But the problem is, there's no effective screening tool. So the CDC recommends that if you're asymptomatic and returning from that area, that you abstain from giving blood for 4 weeks, But I'm pretty sure, and I don't know, does anyone work in a place where they collect blood or anything, blood donation or anything? I don't know if they added on the questionnaire if you had recent travel to South America or Africa, whatever, then they might, scan you out. It's 1 year. All right, so that's good. So they'll probably check it off, and that'll be the end of it. You won't be able to give blood. Thank you for that. So how do we report the Zika cases? I love this picture. That's Barnegat Lighthouse. I can't wait. It's almost summer. It's time to go to the beach, Jersey Shore, right? So prior to this, and this came out about 3 weeks ago. Prior to this, the specimens, or you would make a call to the CDC, and you would talk to them and say, okay, this is what we're doing, but this is not, you can't do this anymore. You have to call this number here. So you could do this from your office. You don't need to send the patient to the emergency department. Go to the emergency department and get tested for Zika. No, we don't do that. This is what we're going to do, And unfortunately, they're only open from Monday through Friday, from 8 a.m. to 5 p.m., and you call this number. So what they're generally going to do is they're going to talk to you about the patient, see where they came from, and then they'll make the decision as to saying, all right, we should test. Now, obviously, if they're pregnant and they came from an endemic area, they're going to say, yeah, send a test, okay? So they're going to ask for urine, they're going to ask for blood and a speckle top, yellow top, and you just send it to them. Okay, so after you send it to them, it'll take about 2 weeks for them to return it, because what they're going to do from there is they're going to move it to the CDC if it's positive. Okay, so if the initial screen is positive, they're going to confirm it at the CDC, and then they're going to go over your patient and see how they do. So nationally, to date, there's 700 cases reported. Half of them are outside the states. And in Puerto Rico, there's a huge, they believe that there's a huge epidemic going on. So thousands of people being exposed to Zika right now in Puerto Rico, only because the Zika virus is endemic there. All right, so 69 pregnant patients, and 7 of them were sexually transmitted from males who came from overseas. All right, so these are the numbers now. And these numbers are obviously going to go up if, unfortunately, the mosquito comes into our southern hemisphere and all the way up to New Jersey spreading this stuff. So only time's going to tell. And, there's certain things that we can do to try to alleviate this. So what do we tell, we're talking about the young couple who's married, who's planning to have children. It's that woman who's going to get pregnant, and they should be concerned. I mean, there's a lot of evidence out there from Brazil showing that there will be complications if you get affected by the Zika virus. So what do we tell them as physicians, And what do we tell our patients who want to go to Brazil to see the Olympics? Now, Brazil is a beautiful place. The Olympics are great. It's this summer. Obviously, you're going to go into a hot zone, because Zika is flourishing there. And what do we tell them? Do we tell them to go? What? So we can't say no. So these are the things. So, if you're going to a hot area, I like to wear a T-shirt and shorts and sandals. Well, guess what you're going to tell them? You're going to wear long sleeves and pants. Not a good thing. But really, that's a way to alleviate mosquito bites. Mosquito repellent, is one better than the other? I like Avon Skin So Soft because it works for me. It might work for you, but it might not work for the next person. And I remember when I was in the military, they used to give us this green DEET bottle. And I read it, and I was like, man, I can't even read DEET. And my friends are like lathering in that stuff, and it's like, my skin is peeling. And I'm like, but you don't have a single mosquito bite, so it's awesome, or a tick bite. So it's working, but you're losing your skin, So obviously house screens, if this does come to our region, obviously, tell your patients, get your house screens in order, make sure you put your air conditioning on, don't open your window, get rid of any trash, anything that can collect water, even your gutters. If your gutters are overflowing, they can breed mosquito as well because of the leaves that are in there. Get your gutters cleaned out. And then, I can see them going into the streets again, and at a certain time, putting out the insecticide, resmethrin again, just to control the mosquito population. And that's going to affect our patients who have issues with breathing, which, it's not a good thing for them. So we have to warn them and make sure that they take appropriate action by staying in the house or just getting away from the area. All right. So this is very interesting. So I think the name of the company is Occitan, and they're, I believe, located in Florida. And what they're proposing to do, and they have done this already, is put a genetically engineered male mosquito out into the area, and they're proposing to do this in the Florida Keys, by the way. They have this mosquito already ready to go. And what it's going to do, it's going to breed with the current female mosquito. And when the female breeds, it only breeds male mosquitoes. Although it's a great idea, it seems to me that the mosquitoes are obviously part of the bioecosystem, considering that I took biology. And you know what? Is it really worth to do something like that in this particular case? Now, they didn't think about that. They thought about doing that for, and they did do it, for dengue and yellow fever in some of the Caribbean countries, and I forget which one it was. But when they did do it back in 2009, they reduced the rate by 99%, so it worked. To date, there haven't been any other issues, but it actually worked. It was one of the American Virgin Islands, I forget the name, it might have been Curacao or something like that. But this is the idea, and it's up for public comment. So anyone who lives in Florida by the Keys, you get to do public comment and see if they're going to go with this or not. But it's an interesting idea. So if you get rid of all the female mosquitoes, you breed only male mosquitoes, effectively you wipe out the Zika virus in that region. A couple of days ago, did anyone see this? This came out, this was sent out by the AOA. And what kills me is, it's now going into, the political arena. And as we know, we had $590 million left over from the Ebola from last year. So that money is there, but they feel that that's not enough to combat, or what's needed to help combat the Zika virus for this summer in the United States. So they're asking for $1.9 billion, and it's stuck in Congress. Congress is like, no, well, we don't have money for that. $1.9 billion, absolutely not a good thing. So they send out the deputy director, Dr. Ann Schuchat, and she says, everything we look at with this virus seems to be a bit scarier than we initially thought. And that was thrown all over the place. Well, even my wife calls me up. What does that mean? What does that mean? So I say, it doesn't mean anything right now. It means that she wants $1.9 billion. That's what she means, you know. So, what do you, it's nothing else. It's just, it's amazing, and they're talking about, premature birth, blindness. So they're adding other things that they're starting to see down in Brazil. All right, so this was sent out. If you guys haven't had a chance to read it, it's actually in the New York Times, USA Today. By all means, take a look at it. So this is where we're at, So it's a pandemic in progress. The Zika virus is definitely a threat to our borders, and at some point it might show up here. So for now, you have to test the pregnant patients that have traveled to a country with exposure to Zika virus, or if they had sexual contact with a male who was down in an endemic area. You want to monitor closely the fetus if they are truly positive, and by the recommendations every 3 to 4 weeks, just to see that microcephaly is not going on. Now, if microcephaly starts to show up and their head is not developing, then you're going to have a conversation with the parents at that point, and to decide whether or not they're going to continue on with the pregnancy. But that's another talk. That's ethics. The New Jersey Department of Health, everyone took down the number. That's who you call. You get a patient from an endemic area. That's where all the specimens are going to go to once they say it's okay to send it. Okay, and then certainly it just keeps coming out every day. Okay, so just keep up on what's going on. Don't panic. In my opinion, we should be ready. Like, as an emergency medicine physician, I'm always ready for whatever comes into the door. And even then, sometimes I'm not ready. But don't panic. You're still a physician, and you're going to guide the patients through this. There's always a certain set of the population that will be immune to it. So for example, I read that Zika virus is in Colombia, and it's spreading there. But they haven't had a case of microcephaly yet in pregnant patients, which is very interesting. So I'm thinking, is that a genetic issue? And, is there something genetically that's going on in Brazil versus Colombia? Because they're a different population. Brazil is mostly Portuguese descendant, and Colombia is mostly Spaniard, right? So it's very interesting. Now, they're keeping an eye on it and everything, but still they haven't had that one case yet, even though they do have confirmed cases of Zika there. Yes?
When is the pregnant female at risk? Do you know? Is it first trimester only, or?
Throughout the pregnancy. So if they get exposed at any point in the pregnancy, obviously the worst is in the first trimester, because that's when your nervous system is developing the fastest, right? So if you get exposed at that point, you're more than likely to get the neurological issues. But if you're in your second or third trimester, they're getting reported cases of complications such as blindness, in these fetuses. So they're saying at any point during the pregnancy, there can be issues. Microcephaly, probably not. Microcephaly is probably from the first trimester. Very good questions. Anything else? I hope you guys can sleep tonight. I really do. Go ahead.
How about pets?
I'm sorry? Pets?
Dogs, cats?
Theoretically, they could get it, but, there have been no studies. So, I can't tell you. And I would think they would be looking at the animal vectors down in Brazil, because they have so many dogs in the street and everything, and perhaps somebody's looking into that, but I haven't seen any studies. So remember that this particular virus jumped from a ape population to us. And there's some genetic similarity between the apes and us, if you believe in the theory of evolution going back to Africa, and versus canines. So I'm not sure. And I hope not. So because I don't want to throw my dog out. So. Any other questions?
You say that there is transmission through seminal fluid. Now, is that the case for oral fluids as well?
They only. You know what? I haven't seen any studies on that. It's only vaginal that I know of. So if you think about HIV, and it's definitely transmissible like that, right? Because there's such a high concentration of the virus in the semen and women swallowed it, and God forbid you have, blood in your mouth because you have poor dentition, you'll get it that way. And I would think maybe you might, but I don't have any confirmed studies to tell you otherwise.